Hello, I'm Amit Goyal, Chief Investigator for the POSNOC breast cancer study that is currently being undertaken in the UK, Australia and New Zealand. POSNOC is the largest breast cancer surgical study in the UK. The study is looking at reducing the extent of armpit treatment that is done for breast cancer patients. Patients who have breast cancer spread to one or two lymph glands in the armpit currently undergo further treatment to the remaining lymph glands in the armpit. The remaining lymph glands are either removed by surgery or treated with radiotherapy. But both surgery and radiotherapy to the remaining lymph glands can cause arm swelling, numbness, shoulder problems, and pain that can be long-lasting and distressing for patients. In most patients, there is no cancer seen in the remaining lymph glands. Importantly, the drugs that we have today to treat breast cancer are more advanced, and armpit treatment may no longer be required in patients. POSNOC is investigating whether additional armpit treatment is still required for patients receiving drug treatment. If we can prove that armpit treatment is no longer beneficial, this will save patients from a lot of unnecessary long-term suffering. This is a large study with multiple teams contributing to the success of this study. In the coming weeks, we'll be producing similar clips to introduce the teams so that you can get to know the team members and how they're contributing to this important study.